Hi, Miss Hops. My name is Sam. I'm going to be your nurse today. I'm here to talk to you about your recent diagnosis with heart failure. Do you know much about the disease, or do you have any specific questions for me? And I would answer the patient's questions the best I could, and if I didn't know a thorough answer, I would get the physician to come in and talk with her. Okay. Well, basically, the heart's job is to pump blood throughout your body, and your blood carries oxygen. So, with heart failure, the heart doesn't do this job very well. The blood can back up because your heart just doesn't pump it through well enough. Um, there are several different kinds of heart failure, and they can have different underlying causes. So it's important for us to find out what the cause of your heart failure is, and that's what we're working on currently. Heart failure can lead to high blood pressure and kidney damage. So you'll be put on some new medications to help with those symptoms. And I'm sure you've been experiencing some fatigue and shortness of breath. It, um, it'll help with that a little bit. Swelling in your extremities, you'll want to elevate your feet whenever possible. Later, I'll discuss those new medications with you. Your doctor will probably come in and go over those. Right now, I'd like to talk to you about a healthy cardiac diet. That's for your heart. You'll want to limit your sodium intake, which is salt. And that's not just table salt. There are several foods that have a high sodium content. Fast food, anything with a lot of preservatives, canned goods, lunch meats, things of that nature. There are others, ramen noodles, pizza, yeast bread, those all have high sodium content. And if you go out to eat, you'll want to watch for words such as cured, smoked, barbecued, broth, anything like that will have a lot of sodium. The best thing you can do is make sure your food is full of color. You'll want to eat a lot of fruits and vegetables. One thing that's great to do is pre-cut those fruits or vegetables and have them in a little container. You can have that as a quick snack. It's easier to just eat them on the go if they're already ready and it's simple. Eating smaller portions, that will not only lower your sodium intake, but that will help with your BMI, which is your body mass index. We want to keep your weight at a pretty healthy level because that will require your heart to do less work. It's already working harder, so we don't want to make that worse by adding excess weight. You can use a salt substitute on your food, such as Mrs. Dash. Depending what type of diuretic your physician puts you on, you'll want to be careful with that because it does have a lot of potassium. So if your diuretic lets you retain potassium, you may not want to use the salt substitute, but he can talk with you about that further. You'll want to cut out meats with a high fat content that clogs your arteries more. Definitely limit your alcohol intake. And I see that you do smoke cigarettes. We'll want to work on that, maybe make a quit plan. And there are plenty of smoking cessation programs. I can give you information about those if you're interested. We have different different things that can help you with that, such as Nicorette gum or patches. There are some medications that can help, such as Chantix, but they do have pretty extreme side effects for some people. Whatever option you're interested in learning more about, just let me know or let your physician know. We definitely want to help you with that. If you have a good support system at home, maybe friends or family can help you with that. You could see if someone's willing to quit with you. Your doctor may also put you on a fluid restriction. That just means you'll take in less fluid throughout the day because your body's not getting rid of fluid as quickly, and the buildup of that fluid can cause problems in your lungs, or it can cause more swelling. That's what the diuretic would be for, to help get rid of some of that excess fluid. Along with that fluid retention, we want you to do daily weights. So you'll check your weight every day at the same time, preferably in the morning before you have breakfast. And you'll want to do that either wearing no clothes or very similar clothing. Your doctor will give you a parameter on when he wants you to call him, but generally, if you gain 2 to 3 pounds in one day, your doctor will want you to call. Because your heart isn't pumping as it should, that fluid can build up in your body, like I said. That also does make the shortness of breath worse. If you have shortness of breath that's extreme and it doesn't get better with rest, we'll want you to call 911. Other symptoms that would warrant calling 911 or going to the emergency room is chest pain that does not resolve with rest, or coughing up pink frothy sputum. Definitely call then. Regular exercise is very important. If you're unable to tolerate more strenuous activities, we want you to try to at least walk about 30 minutes a day. That will help keep your heart as healthy as possible. It will also help keep your blood flowing. It's very important to take your medications as directed. We want you to take them exactly how they're prescribed and do your best not to miss any doses. If you start experiencing side effects that you feel you can't tolerate, please call your primary care physician rather than just stopping the medication. And he or she can see what adjustments need to be made. Do you have any questions about any of that? Okay. So I would answer the patient's questions, and again, if needed, get the physician to answer some questions. Can you tell me how you will do your daily weight each day? Okay, so they would tell me that they need to do it at the same time every day, wearing nothing or the same clothing. I do have a couple handouts for you and some helpful resources. The American Heart Association website is great. I have a couple of websites that have recipes for cardiac healthy diets. I have here some symptoms, a symptom tracker, so you can track your symptoms each day and see if you have any significant changes. That would be great to bring into your appointments, and also just for your personal use. All right, do you have any questions about any of that? Okay, here are your papers, and just let us know if you think of anything.